The 24th International AIDS Conference, currently underway in Montreal in Canada, is drawing to a close tomorrow. Delegates there include researchers, medical practitioners, activists and people living with HIV. Now, the conference focuses both on scientific progress in the fight against AIDS and also the need for increased funding for HIV response. It will also explore a range of topics from surveillance ethics and health innovation to HIV cure and vaccine research. For more on this, we're now joined by human rights activist Steve Letsike, who's of Access Chapter 2. Steve, thanks very much indeed for joining us. Welcome to the program. Thanks for your time. I wonder, what new things have come to light at this particular conference, or are we having the same conversations year after year?
No, Peter. In fact, I think what is quite interesting, beyond conversations that we are used to of trying to get everybody on track, we know, of course, COVID has disrupted so much, as you have said, but it had pushed us off the mark a little bit across the world, where we have seen that we are not necessarily meeting the targets of reducing the new infections, but also we're not meeting the targets of making sure that people living with HIV have got access to treatment and they are virally suppressed. I think, of course, when you look at conversations that are taking place here, one, it's emphasis of making sure that those who are on treatment is to remind everybody that if you take your treatment at here and you are virally suppressed, you can actually become undetectable. And I think this is the message that we need to rehash, even in South Africa, that treatment can be used as prevention and we can curb the spread of HIV. But secondly, a reminder of TB, that we cannot talk HIV and not talk about TB. It's one of the biggest challenges in South Africa. It's one of the biggest issues in the world. And lastly, of course, it's around how do we change the narrative? How do we decolonize the funding, financing, and the response and the makeup of what is available? And I think that's the thorny one, as the world, that we reflect on where has the money gone? Where are the resources going now? Because there are competing priorities, climate change and many others. And we've seen it even in our own country. But it's to then say, with the little that we have, we can do better. And we can use the new technologies, the proven scientific evidence that says reduce, prevent as well as treat.
All right, tell us a little bit about the session that you presided over, and I'm fascinated to hear, looking at racism and AIDS.
Well, Peter, I think, we cannot run away from the historic colonization that we have been experiencing across the world. One thing that is common in the global south in particular has been a colonization, and we share that history of prejudice. But we cannot speak about having a response that does not take the interest of people at heart. At the center of response is the people, is the very same people who are living with HIV, women, children, LGBTI, and many other key and vulnerable population. But when you look at the response, they are not at the center. And at the same time, race plays a significant role. So, of course, issues of class, issues of power and money plays a very critical role. And I think what has been quite important about the narrative is that we have Black excellence. Let's not run away from that. Why are we talking about epidemics in Black or global South communities, but the response does not carry the knowledge, does not carry the resource investment around that? So I think the narrative has to shift, the resource, the power dynamics, and also naming and not being shying away from what racism has to do with the response that we are seeing, and why are we not winning at the same time? Because of the very institutional violence, the institutional discrimination, but at the same time, the dominance and power dynamics that exist.
So how do we respond, particularly as a continent?
Look, I think we have demonstrated excellence in the past couple of years as South Africa, as sub-Saharan Africa. We know we are hit by these epidemics. We are the most hit by the epidemics in Africa, where you talk not only of HIV, you talk TB, you talk Ebola, you talk, and even with COVID. But at the same time, is the inequalities that exist, the social and structural inequalities, the economic exclusion is going to carry that center. So where we need to be moving, we need to upscale what has worked in the global south. We need to build solidarity with geographics or areas that are hard or that are difficult. We need to pay attention to tailored interventions. We know exactly what needs to be done. So the resources that of course are controlled elsewhere, and they delay even in the health seeking aspect of it. We need to redirect resources to where it matters. Spend now in order to save later. So what we need to be also doing as country, like our own country, we are developing a new strategic plan. Every 5 years, our current one has come to an end. We know what has worked around prevention. It means we must run. We must not be caught wanting, even with the response on treatment, even with social and structural drivers. I mean, just now, Peter, the president will be hosting presidential social summit. I mean, I fly out, I come back there, and we are already going to be knocking in terms of addressing some of the social and structural drivers.
All right, so I think you started speaking about this a little earlier, but I am curious also about one of the messages of the conference, that if treatment has rendered the viral load undetectable, the virus is no longer transmissible.
Look, I think it has been proven. This is not new just only for this conference. It was said just about 4 years ago that U equals to U. We have 8 million people living with HIV in South Africa. We also have 37 million people living with HIV across the world. If we can get as many as possible, over 95% of people living with HIV, not only just to know their status, but to actually take treatment and adhere, we will get to suppress the viral load. Now, what is the issue and the challenge? And I think the message here about follow the science, invest in the correct measures that are put in place. We know many challenges in Asia, in India. They've got challenges around issues of whether they can test the viral load and they can track and monitor it. Here in South Africa, back home in South Africa, we know we do it. So we need other countries where the burden is mostly high to be able to actually implement the whole U equals to U programming or modeling in full. We don't want people just to be taking treatment and you cannot monitor or track where the viral load is or where the CD4 count is. So the products that are meant to be scientifically helping us to monitor where the epidemic is going needs to be completely done. So what we know and what we understand is that address the elements of behavior, address the elements of treatment, address the social and structural elements. We can beat AIDS by 2030, but only if we spend now, only if we do it right, only if we work together as a collective. Government must take responsibility, civil society and private sector, including the support of development agencies in curbing the HIV response.
And only if we take care of our most vulnerable, which is our young women. How do we help them?
Look, Peter, I think there are quite a number of issues and challenges here, that we always talk about. I think what we have seen is signs of reduction of new infection, even amongst adolescent girls and young women. One of the biggest challenge for us in South Africa, we still do have high new infections per week. 1,200 girls between the ages of 15 to 24 still gets infected weekly in South Africa. Now we need to lower this. We want to close the tap of new infection, but we can't close it if we are not prepared to speak about teenage pregnancy or statutory rape, if we are not prepared to deal about the economic exclusion, if we are not prepared to talk about behavior of men in society, we are ought to deal even with the role of parents, how young people are equipped, the implementation of comprehensive sexuality education in schools must effectively take charge. And we cannot accept that some social institutions want to abuse power, like faith-based sector, who would want to kick out comprehensive sexuality education. It has been proven to be actually excellent scientifically, equipping young people, giving them resilience, knowledge in how they can make the right choices. It's a developmental issue. But at the same time, when we speak about young people, give them agency. Young people understand they are brilliant, they are excellent, they are empowered. And if they're empowered, they will make the right choices. And give them opportunities to participate in other social activities. Don't expect young people will just sit down and relax and while they are confronted by social issues. Don't expect young people not to be part of solutions while we do not create those opportunities for them. So I think we can do better as South Africa. When we say addressing adolescent and young people, we mean ensuring that they are part of decisions. They have a seat on the table. We can't speak about young people without them. Give them that agency.
Steve, always great talking to you. Thank you so much indeed. And we wish you more at the final stages of this conference. And perhaps we can catch up when you get back to give us a comprehensive update. Thanks so much for your thoughts tonight.
Thank you.
All right,
Thank
that's
you
activist, human rights activist Steve Letsike of Access Chapter 2, speaking to us all the way from Canada, where the International AIDS Conference is taking place. And new conversations happening, and saying that we can deal with AIDS by 2030 if we do all the right things.